Everybody, my name is Chrissy Ski and I would like to present to you a presentation that I have come up with for you girls today. It is called Polycystic Ovarian Syndrome, the Cousin of Diabetes. Our lesson objectives for this lesson today include comparing and contrasting how diabetes and PCOS are related and how they each affect the body. Identify treatment options for a potential diagnosis of PCOS or diabetes. Assess signs and symptoms of low self-esteem related to the effects of diabetes and PCOS on the body, and describe how the disorders of PCOS and diabetes are hereditary. First, we'll start off talking about what exactly is polycystic ovarian syndrome. It's also called PCOS, and it is when our hormones get very mixed up. Small grape-looking clusters form on our ovaries, and these little clusters can cause us a lot of pain. Whenever our hormones get messed up, several things can happen to our bodies. The symptoms of polycystic ovarian syndrome include having more pimples than usual, a lot of stomach pain, our periods not being on time, and a lot of hair growth on our body in places that usually hair is not there. Weight gain and mood changes or feelings of sadness or depression. What is diabetes? Our healthy body's pancreas produces enough insulin to bring our blood sugars down. Sometimes our bodies either do not make enough insulin or do not know how to properly use the insulin that is made. When this happens, it results in our bodies having a high blood sugar. Symptoms of diabetes can include a person feeling very thirsty, very hungry, using the bathroom a lot, losing or gaining weight, and darkening of skin around the neck. How are PCOS and diabetes related? PCOS can cause someone to become resistant to insulin. This means our bodies will not use the insulin that is made by our pancreas. High insulin levels tell our ovaries to make more of the hormone testosterone. All of these things tie into one another. PCOS and diabetes are cousins. Who is affected by these disorders and why are they affected? Most girls are diagnosed in their adolescent years, which is about the age range of the girls in this classroom. And both of these diseases tend to run in families. If your mom, sister, or grandmother had one of two of these diseases, it means that you have a greater chance of getting it as well. What organs and hormones are involved in PCOS? You're going to hear several names of these hormones, so I would like for you to become familiar with their full names. Estrogen, luteinizing hormone, follicle stimulating hormone, and testosterone. All these hormones work together to help our bodies to have periods every month and as well as develop our sexual features such as breast growth, hair growth, and etc. Below is a picture of the female reproductive system. You see a normal ovary on the left and a polycystic ovary on the right, and you see those little clusters that they have on them. How will diabetes or PCOS affect my future and my self-esteem? These diseases may cause you to feel very sad. It also could cause you to have low self-esteem or feelings of being different or not fitting in. It may also affect your ability to have children in the future whenever you get older. Several great treatment options do exist for PCOS and diabetes. One is dieting. Make sure you follow a good diet. Number 2 is exercising. Number 3 is getting some counseling for whatever feelings of sadness or emotional issues that you could be having related to these issues. And medications such as birth control and diabetes are two common ones used to treat the symptoms of PCOS and diabetes. The first medication we'll discuss is birth control, also called an oral contraceptive. They keep the ovaries from releasing an egg every month by turning a few hormones off. These pills produce hormones at more normal levels that are supposed to be present in our bodies otherwise. The pills will also help keep your periods regular every month. Side effects are headache, depression, nausea, vomiting, spotting, or high blood pressure. Interactions include medication interactions with antibiotics and some types of pain medicines such as Tylenol and ibuprofen. It is also important not to smoke while taking birth control pills as they can increase your risk of having blood clots. The second medication we'll talk about is called metformin. Metformin brings our blood sugar levels down. It also helps decrease certain hormone levels that can cause acne and excessive hair growth. Side effects are our stomachs feeling full or bloated, diarrhea, nausea, vomiting, or low blood sugar levels. Interactions include alcohol drinking, contrast dyed medical scans, and certain medications taken for the heart. I think everyone is probably wondering after this presentation is finished, how do I tell someone that I have these symptoms? If you are experiencing any of these symptoms or feel that something is wrong or going on with your body and you're feeling different, please tell a trusted adult such as a parent, grandparent, or guardian. It is very important that you speak up that if you feel that you have something going on with your body, because only you can know your body. I'm welcome to answer any questions that you may have after this presentation is over, and I will be passing out some pamphlets to you that has many of the information that I discussed with you on it, so you can look back on it for future reference. Thank you everyone for having me and for letting me present this information to you.